Good morning, this is Dr. Cruz of Healthy Feet Podiatry, and today we have a special case of a pesky ingrown toenail. So this patient has several procedures done to her nail over the past few years. She had a total nail avulsion done, and after that, most of the nail didn't grow back, but now just the two corners, which I'll show up in a picture because you can't really see it, so I'll put a picture up top. But the two corners are growing in, and we got to cut them out. So we're doing a modified, what's called a modified Zadek procedure. And essentially what that means is we are going in there with a sharp blade and removing the nail matrix, the part of the anatomy that grows this part of the nail. But what I'm going to do, which is part of the modification as well, is instead of removing the nail first, I'm going to dissect around the nail and find out where exactly that matrix has formed again, because it's not in the normal spot where you would usually do a chemical matrixectomy. So I'm going to find where it's growing from, then remove it with the whole nail attached. So that is the plan, and we'll do some updates during the procedure itself. Hope you enjoy it. That's the one side, and then the other side's smaller. You can barely see it. I haven't really lifted it out yet because we're concentrating on this one first. So we're going to make a small incision in this angle, and we're going to see the matrix. So that's what we're going to do next. There. You can watch this afterwards since we're blocking your view. I like it. Let's pull the curtain back and then can't cover it up with the camera.
Well, actually, I can see it on the camera.
Okay, cool.
So.
There we go.
There we go. Just a nice, simple incision. Nothing crazy. She's bleeding a little bit more than I'd like, but I can fix that in a second. Very good. Yeah, exactly. I wish.
I did stop taking my aspirin and, the omega-3 and whatever.
That's okay. You're not going to bleed out from your toe, so I'm not worried.
No, I didn't think so.
I'm not worried. We're just going to dissect that open a little bit and take a peek down there where the nail is. I'm going to have to cut a little bit more. Go ahead and right. So here comes the nail emerging from the side of the nail bed, and it's pretty tiny, but nonetheless it doesn't take much to cause pain in your toe. So now it's going to be cleaning up the rest of that matrix that was left over, which you guys can't really see, which is okay, but trust me, it's there. So I'm going to remove it right there. All right, so now we are removing the leftover matrix. Ooh, I need to cut a little deeper. Hold on. I wish I had another hand, but I don't. That is Levon. Can't say we're not lighthearted here. All right, there's one piece of it. I'll get the rest. That was perfect timing.
It really was.
This is definitely going on YouTube now. How can you pass up that opportunity? It's too funny. So as you can tell, the patient is perfectly comfortable. No pain whatsoever. Oh gosh, that's fun. That's fun. See, Monday morning fun. Yeah, don't shake too much. Don't laugh too hard, please. All right, we're almost done. There we go. Yeah, maintain.
Carving my initials on my.
Yeah, that's right. There's a big and a J and a C on this thing. That's it. All right, I think we are good. We don't have a cure bone. Okay, so that means that there is no matrix left.
I can't feel anything.
Does that make sense? Because
Yes.
if I went through the soft tissue and took it out.
Yes.
Yep, so that is the plan. Mm-hmm. We have mission accomplished here. I'm just going to take another check. Everything looks pretty darn clean all the way down. Mm-hmm. There is nothing left. There's no toe. No, we're good there. So that's good. And now this